to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman, and here's what I bring to you all from the world of medicine. Probiotic backpacks as a potential treatment for inflammatory bowel diseases. Like elite firefighters headed into the wilderness to combat an uncontrolled blaze, probiotic bacteria do a better job quelling gut inflammation when they are equipped with the best gear. A new study by researchers at the University of Wisconsin-Madison demonstrates just how much promise some well-equipped gut-friendly bacteria hold for improving treatments of inflammatory bowel disease or IBD, including Crohn's disease and ulcerative colitis. Led by Kuan Yin Hu, the research builds on technology the team had previously designed. That prior technology encases beneficial bacteria within a very thin protective shell to help them survive an onslaught of stomach acids and competing microbes long enough to establish and multiply in the guts of mice. Anifrolumab, an oral deucravacitinib, shows promise in patients with lupus. Type 1 interferon or IFN is a powerful immune activator that is present at high levels in the majority of patients with lupus, which is an autoimmune disease. In arthritis and rheumatology, researchers report positive results from the first placebo-controlled long-term trial of anifrolumab, a human monoclonal antibody that targets the type 1 IFN receptor in patients with lupus. In the long-term extension trial of two earlier phase 3 trials, patients continued anifrolumab 300 mg, switched from anifrolumab 150 mg to 300 mg, or were re-randomized from placebo to either anifrolumab 300 mg or continued placebo administered every 4 weeks, with all patients also receiving standard therapy. Anifrolumab was administered as a intravenous infusion. In patients with knee osteoarthritis, nerve-blocking anesthetics around the knee relieve pain. Results from a recent clinical trial published by Wiley in Arthritis and Rheumatology demonstrates that patients with knee osteoarthritis experience short-term pain relief from genicular nerve blocks or locally injected anesthetics that block nerves around the knee joint. In the trial, 59 patients were randomized to receive a nerve block or placebo injection. At baseline and weeks 2, 4, 8 and 12, participants recorded their pain on a scale of 0 to 10. Long COVID outcomes occur in all ages. Following COVID-19 infection, there is significant new onset morbidity in children, adolescents and adults across 13 distinct diagnosis and symptom complexes, according to a new study published in journal PLOS Medicine. Studies have established that some people infected with COVID-19 suffer long-term health problems following the acute phase of the disease. However, evidence on post-acute syndrome is still limited, especially for children and adolescents. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.